So I'd like to bring up the founder and CEO, Omri Shor, to his friend, Bob. Go on up.
Okay, so good afternoon everyone. My name is Omri and I'm the founder and CEO of Medisafe. Our story begins with my father about 2.5 years ago, when he came to me asking if I saw him inject his insulin. My answer was no, and he accidentally overdosed on his meds. So we've decided to do something about it. You all know the problem of non-adherence. It's a multi-billion-dollar problem. Every 90 minutes an American dies. And we think that in the heart, in the center of this problem, there is the problem of data flow, from the physician's office to the patient, to his family, to his care manager. But something in the data flow is not working. So our mission is to create the leading real-time medication management platform available out there. And this mission is now accomplished. And it's not us saying so. It's the patients. We are the top-rated medication management platform, rated 4.5 out of 5 by nearly 40,000 people. We have 900,000 downloads, and it's going organic because people recommend Medisafe to their friends, because physicians and nurses recommend Medisafe to their patients. We are also a top developer in Google Play, the only medication management solution that is a top developer. And we won quite a few awards. The last one was Q Prize by Qualcomm Ventures, and we won first prize out of 1,200 startups to join the Qualcomm Ventures portfolio. And we won the Digital Health World Cup last year. Fast Company named us as one of the most innovative companies in healthcare, number 4 actually, and we were featured by the media on all major publications. So how did we do it? We focused on the consumer with a really good, really engaging user experience. What you see here is the pill box, 4 quadrants, morning, noon, evening, and night. And on the morning quadrant, you can see the 2 pills that I actually took. When it's time for me to take my atorvastatin, I get a notification. Very simple, with simple instructions of how to use that. I want to show you the next version of Medisafe that would actually be released next week. So you see here, it starts with a reminder. It's a personalized contextual feed. It's like Google Now for healthcare. It continues with the family notification. So Medisafe is the first company, was the first company, to bring into the space the microsocial network, my connection to my wife, that if she didn't take her birth control pill, I get a notification and make sure that I don't have no kids. Patient education. Why am I taking this drug? Explanation about my condition. Positive reinforcement. Good job, I'm taking my drugs correctly. Contact for assistance to an external call center. Diet tips and content. Biofeedback. How is my body reacting to what I'm taking through time? And finally, medication costs with coupons and discounts. All of those together create a very engaging solution that is very differentiated from everything else, and consumers think the same. Just about 2 months ago, we were the first company to introduce a medication management solution on your smartwatch. We didn't do it because it's cool. It is cool. But we did it because it allows us to track motion, to understand the patient, to get to the patient even closer than what we did before, and to get all this data of steps, sleep, heart rate, cross that with your medication, and you get a very large-scale data collection solution. Speaking about data, Medisafe now has 65 million medication doses reported taken using our platform. This is important to us because Medisafe is eventually a data analytics solution. We understand what patients are actually taking and how they consume their Lipitor versus other atorvastatin, with ages, gender, location, and consumption patterns of usage. So to summarize, Medisafe is the leading medication management platform. We are the #1 rated solution in the market. We have 900,000 downloads and hundreds of thousands of people that use us on a weekly basis. We have a lot of data. We're just 2 years into developing the solution, 1 year into funding, and 1 million into funding. Just imagine what we will do with the next 5 million. Thank you very much.
All right, and by the way, this is our token well, you're our token international, and by the way, Pascal says that you're European, even though you're from Israel. I don't know quite how that works out, but we want to show that we do a lot of work in Europe, and we actually had one at our Europe conference in London just last time.
So, Andy Geers from Healthcare Capital.
And you're European too, but
and then well, I used to be European, I guess.
Slightly.
And so several questions. What is your revenue model? I mean, clearly it's a free download, which is why you get so many downloads, but how do you make money at some time? And then the second one is that I followed this space for 30 years, unfortunately I'm getting old, and they only failed. Why do you think you found the secret sauce?
Thank you. So, just because you were asking, I have a slide on that. We have 3 opportunities that we're working on at the moment. The first one is prescription refills. We work with a few companies in the space of prescription refills, and we get a transaction fee for every fulfilling of a prescription that is done through Medisafe. Second one is native targeted messaging, advertising. We know what the patients are taking, and we know when, where, and everything about it. So we do advertising, but we call it messaging because it's just for the drug itself, it's not for competitors. And finally, the data. The second 2 are actually already, we're already monetizing on that. We have 4 pharma companies that started working with us. And the last pilot that we've signed was about $60,000 for a year. So, and that was all in Israel. And now that I'm moving to the States in a month and a half, we plan to do the same here, but scale it up.
So that was a really nice answer to another question, which was about your business model, not about your success. And so, to some extent, I want to go back to the question for the previous session, the previous company. There's so many things like this. How do we tell yours apart? And just one would be some actual clinical trials, not just how many people have downloaded it or how many meds have been taken, but can you actually move that needle? I just downloaded it. Anybody, you can do that too. It's not really useful telling me to take something at 8 p.m. I need to take it just before I go to bed. So how do you make it actually usable by normal people and really viral? It seems you've done pretty well, and I'm pressing you because I would love to see one of these succeed. We hear about them all the time, and they don't really seem to have much impact in the end.
So it's a bunch of questions.
Yeah.
First of all, we're starting a controlled, randomized clinical trial next month. So it's all the protocols are in place, and it's going out this month. We've succeeded, I think, with a few things. First of all, we've focused on the consumer, and we've iterated really quickly to understand what people need and how to implement it quickly into the solution. I think that differentiation is important. So when we see, I have a deck that I usually have on user experience, and we've designed the user experience to be very unique than everyone else that you see in the market. So this is number 2. How can we make it viral? So what we're working on at the moment is on 4 programs that we've created inside the team. So one of them is how to create this virality naturally. It's with those discount cards. The second thing is how do we make physicians be aware of the solution? How can we use our users to float it up to the physician? So we call this initiative M3. I'll be happy to elaborate on it. So all kinds of initiatives that will help us grow exponentially.
All right, so we have one last question for the entire judging, and it's going to go finally to Rebecca, who A, hasn't asked a question recently, and B, was the founder of DCWC, which is the Star Competition Attraction, is kind of replacing both you guys are on a hiatus or coming back or whatever. But so
Okay, we did a health conference in 2010 or 2010 when you guys had just started Health 2.0 and there were 0 health IT incubators. It was pretty interesting. And nobody was investing in healthcare IT except really early stage. So anyway,
It's good the herd effect works, right?
yeah, absolutely. It's where they follow the money. I said except for really early stage. Yeah, was there. What I was going to ask are two things. So I have a little bit of a different perspective. I don't think there's really any unique tech anymore. And it's all about customer acquisition and then how you keep them around, right? So how do you acquire your customers? Because you don't have to have the best product if you can win on getting a customer, right? It's my P&G training.
Right.
And part 2 is how many people are around after 6 months? So how do you keep them?
Right. So your first question is actually easier. People tell about us to their friends. One of the things you'll find out, Esther, later on, is the sound of Medisafe. It sounds like a shaking pillbox. So people take that to their work, and it sounds a bit like a rattlesnake. So they ask, what's that sound? And find out about us. This is one way. If you go on Twitter and you write the search word Medisafe, you'll find out that many people write about us. So we have a good word of mouth that people are sharing our solution. So this is one, and initially or inherently, we are a family solution. So when you're using that, your family members would use it as well because we're connecting family members. So this is the uniqueness of Medisafe. How many people use us over time? It's a unique percentage that if you'd be interested, I'll be happy to sit with you and show you the cohort analysis. But it's high. It looks very good. But one of the things that actually we're creating this feed that is actually even more promoting user engagement over time. So this is, we think that it could be even better. So I'll be happy to sit with you. Thank you very much.
Thank you. Very good.
Thanks, Paul. All right, so we're gonna.
Wait, I got my opportunity to comment, which is, you just had a baby a couple weeks ago, yeah?
Well, actually, I gotta say that the
Which
pig is involved in the
demonstrates-
chicken, the